Check out this article. Medical students fought to get training in abortion care. Then came Dobbs. The article paints a grim picture of medical students who just want to perform, quote, ethical medicine, meaning provide abortions. And then it suggests that because of Dobbs, a great number of doctors are avoiding working in or moving to or studying in pro-life states, and this is going to increase disparities in healthcare access. What's the evidence for this? Well, the author looks at a couple of different surveys. I'm going to walk you through them. First, she claims a study last year found that 82.3% of practicing physicians and doctors in training preferred to practice or study in states with access to abortion. She's talking about this study from the Journal of General Internal Medicine. When they say they surveyed physicians, they mean they had a non-probabilistic sample of physicians and trainees from social media communities, meaning Twitter, Facebook, Instagram. Social media is disproportionately likely to sample younger and left-leaning people, which are both disproportionately likely to be pro-choice. Consider the fact that Guttmacher has found that something like 7% of OBGYNs provide abortions, and yet this study, which wasn't even just for OBGYNs, it was for all kinds of doctors, 27% of respondents said they were current or future abortion providers. The authors kind of acknowledge that when they say the limitations include self-selection bias and a non-representative sample, and results may not generalize to physicians not using social media. The author says a study published in November found that the post-Dobbs reduction in obstetrics and gynecology workforce could significantly exacerbate maternity care desert. Now she's talking about this survey, which was published in Obstetrics and Gynecology, specifically surveyed obstetrics and gynecology residents that were with the Ryan Program abortion training programs. Ryan Program trains residents on second trimester D&E abortions, and it has a module called An Introduction to Reproductive Justice. And as the authors rightly point out, the residents they surveyed may elect to participate in the Ryan Program because they're more likely to be invested in abortion care in their future careers. It's not particularly surprising when this study found that residents who want to have advanced abortion training are more likely to want to live in states that don't have abortion restrictions. Perhaps more surprising is that less than 1 in 5 of the survey respondents actually changed their plans based on Dobbs. Somehow the authors conclude from this that pro-life states may see a significant reduction in the obstetric workforce. Finally, the article goes on to say, alarmingly, last year the Association of American Medical Colleges found a drop of greater than 10% in med students' applications for OBGYN residences in states with abortion ban. So now we're talking about the Association of American Medical Colleges data, which actually said that there was a small scale of changes in the number of applicants year to year and only a small effect observed in abortion-banned states. They say small effect, they mean a small variation in who is applying to which states. They don't mean that there were less residents in abortion-banned states. In fact, they say, despite these changes, all residency positions in OBGYN were filled this year and with a similar number of U.S. MD seniors as last year. Nationally, the number of residency applicants continues to exceed, far exceed, by the way, the number of training slots available, so residency programs in states with complete abortion bans may continue to fill their residency programs. The author goes on to quote multiple members of Medical Students for Choice and the Deputy Director for Nurses for Sexual and Reproductive Health. How does the author describe the position of doctors who oppose abortion, or at least those who aren't specifically pro-choice activists? She doesn't.